In the move to regulate and improve on the quality healthcare in privately owned health facilities, Ministry of Health and its regulatory bodies have launched a new digital platform that will strengthen its supervision. The platform is aimed at modernizing supervision of the private health sector, shifting away from the archaic system of going door to door and looking for what is wrong with the health facilities. Director General Health Services at the Ministry of Health, Dr. Henry Mwebesa, noted that the tool will later be mandatory for all privately owned health facilities, including drug shops, pharmacies, dental units, radiology and laboratories in the country.
But we want to introduce it slowly. We don't want to jump into things and then tomorrow you start refusing to register people because they have not filled this. So we shall start slowly. We get them to appreciate it. We get them to know, and then eventually it will be a requirement in order for your hospital, in order for your clinic, in order for your lab or pharmacy to be registered. We are not doing a tool where when we find gaps we run to close them. Of course we are doing it together with the councils, so we don't run to close them, but we are emphasizing to the councils that you go and support the private facilities to improve the gaps so that they can provide better quality services to our people.
Over 400 mobile tablets were handed over to different health facilities, especially the hard-to-reach areas, to facilitate easy data and information collection. The Ministry of Health, together with the local governments across the country, will have access to the data in the platform through several dashboards that will indicate performance from facility level, district level and national level that will influence the formulation of continuous medical education seminars.
We already have a system where we produce licenses for doctors or for health workers who have completed 40-80 hours. It is now automatic. You don't need to come to council to get that. So we are insisting, and we want to make sure that people get their licenses before December 31st as per the law. But going ahead with this system, we also want it to be online because we have agreed with the private sector. It is a self-regulatory tool. You are going to score yourself. If you get 80%, you will get a license. However, our inspectors will be coming to check if really your 80% is really 80%.
Grace Kiwanu-Kasali, the Executive Director of Uganda Healthcare Federation, emphasized that the new approach recognizes private health sector
to self-assess, to know what is going on using 16 service elements, and the system generates a quality improvement plan unique to that facility, so that the activities are broken down into monthly interventions that are risk-based, and it allows the facility to also understand through an e-learning platform how they can skill themselves internally to be able to speak to those gaps.
Support the private healthcare facilities to be able to comprehensively address the issue, and therefore we sought funding from MasterCard Foundation. So this program is one of the components under this funding with MasterCard Foundation, which is about $8 million, and this is one of the components, and it was to help see how the private healthcare facilities, which is where most of the people go at a local level, how can they be able to self-assess and then meet the minimum standard that Ministry of Health needs.
Zahara Abigaba, UBC News.